I think I shared it with you. We finish with the slides. We're almost at the end. Be patient enough. So, this is a kidney structure. Fat tissue next to the pylon. Here, not many of glomeruli, but lots of tubes here, which we can observe. And later, a couple of vessels, which are appearing a little bit with a thickened wall, and perhaps some fibrotic changes in the intimal layers. Later, we continue with the glomerular structures, which are having some inclusions inside in the capillary loops, which are eosinophilic, globule-like, and you can see that they are appearing on multiple places. Here one, here and here. Here also, let's see a more evident one. This one is best observable. So, as far as we can see, these are actually Kimmel-Wilson bodies in between the capillary loops. They appear with eosinophilic structures. They're usually PAS positive. And what we also observe here, the proximal tubules, is that there are not many of nuclei. Do not bother to think this of renal insufficiency. This is due to the fixation of the slide and the postmortal lysis of this patient. So, again, a Kimmel-Wilson body, again one, and again one here. As far as I remember, we paid a lot of attention to this type of disease when we were on practicals. Do you remember the stages of diabetic glomerulopathy when we discussed it in practicals? Can you write them down? There are 4 stages of it. So pretty much we mentioned everything that we should observe about this type of disease and how we diagnose it, depending on the look of the glomeruli. They appear pretty much normal, except by the deposition of these substances in between the capillary loops. So I think it's pretty much diagnostical like this. But anyway, you should be able to mention the stages of diabetic glomerulopathy. By the time you make a short review, I will share the next one. So which are these stages? Whoops. Okay. Next 3 minimal changes. Hypertrophy and majorly some not well recognizable depositions. Next. Well, we speak about stages of this histologically observable changes due to histology. I agree with microalbuminemia, but it's not something that we can observe on the histology. Yes, and also the thing that we observe now, Kimmel-Wilson depositions, should be included in the 3rd stage. Yes, highly knows it. And the 4th one is fibrosis. Finally, after everything that happened to this kidney, they suffer sclerosis. They cannot work anymore. They're completely hyalinized. Okay. So now we continue with the next one. I think I share it. I checked a couple of times.